I think the latest surge with the Delta variant is very confusing and frustrating for people. We felt like last summer there was no travel. There was all of these extended periods where we thought we can't travel anymore. And now with the Delta variant, it's starting to feel very 2020 for people.
The hyper-transmissible Delta variant of the coronavirus has now forced some would-be travelers to consider whether it's safe to follow through with their trips. Here are a few questions that can help you make that call.
There are things that you can do and that you would want to do to protect yourself, protect your family, your loved ones with whom you will travel or to whom you will go visit, as well as those you don't know, but with whom you will interact. So first and foremost, you would consider if there is no reason why it can't happen, such as your age is too low. It is strongly suggested that you take one of the, here in the United States, 3 vaccines approved under the emergency use authorization. So that's number one. Once again, when you're going to be with others, you would want to consider wearing a mask. And also, if you are in groups of people, particularly those who you do not know, then this concept of physical distancing of 6 feet or more becomes important.
What does the pandemic look like at your destination?
I think that right now, a health expert would tell you you want to make sure you're not going to a place that has a surge of Delta variant cases where you are going. You can look at the local health department website of the place that you're going, or a simple Google can pull up those results on the Washington Post sometimes and see, is this place that I'm going to a hot zone for the Delta variant?
When was the last time you were tested? Is there a chance you're putting others at risk?
So if you're going to visit family and let's say you're going to drive or take a plane, you probably would want to consider being tested and prove to yourself that you are not infected before you travel. And seeing that the turnaround time for PCR tests is variable and usually costs more the quicker that you want it, you probably want to consider having the test collected 2 to 3 days before you're going to travel. And you can even take the test result with you if you want. Here in the United States, it's not necessary, but for some countries it is. You have to show it on entry.
What about travel insurance?
Now that we are living in these pandemic times and you don't know what's going to happen a couple months down the road, people are recommending getting travel insurance, particularly if you're going to be going on a trip that requires you to put money down up front. So that could be an all-inclusive stay somewhere, or going on a cruise if you are one of the brave souls who are starting to go on a cruise again. If it's something where you're going to spend a weekend at your friend's house in Los Angeles, or you know that the Hilton has a good return policy or refund policy, or they're going to let you change your plans without a fee, travel insurance might not make sense in the same way. However, what you want to do is make sure that your medical insurance covers whatever you're going to be doing just in case you get COVID abroad and you need to be helped in that way. Or not even abroad. If you get sick domestic, you want to make sure that you have coverage where you're going just in case.
So, is there some sort of blanket rule on whether or not you should travel? Not exactly.
Really, it's a risk assessment. It's what are your underlying health conditions and those for members of your family? What is your risk tolerance? What are you going to be doing? So as you can see, one size can't fit all. Now, with that in mind, there are places in the United States that are riskier than others because they have higher levels of ongoing transmission. You should realize that the Delta variant is everywhere, and it is highly transmissible, more transmissible than the virus was at this time last year.